he was wandering the streets of his neighborhood, mumbling about the war, just really out of it. So they brought him to a hospital. He was resistant to come because he was on night watch, according to him.
Oh, okay.
So he was a little bit confused. He wasn't orientated to time. So the PA came in and he has a new diagnosis of dementia. And so it's progressing. The family did come in, his wife and then his brother. They reported that he was having strange behavior the past, couple months that they've noticed. He forgot how to work the remote. He always mows on certain days, and he was mowing on off days, mowing 2 or 3 times in the week. His schedule was just seeming to kind of be off, but they didn't really think anything of it until this episode of wandering.
Okay.
I did give him a dose of ordered Ativan. He was really agitated, so that's probably why he's sleeping.
What time did you give that?
About 6-ish,
Okay.
not too long ago. The PA did order some new medications that you guys are gonna have to give him, like Razvan and Aricept, for his confusion and orientation. Do you have any questions? Oh, he did fight in the Vietnam War.
Oh, okay.
So that's where that came from.
Did your family say what time they're coming back at all?
Yeah, they just stepped out to get some breakfast and some coffee. They'll be back in a little bit.
Okay, perfect. I imagine they'll have questions with the new diagnosis.
Yeah,
so.
they were very supportive, but they do have some questions.
Okay.
Where's the nurse? We need to page her. I'm getting worried.
You guys page? Everything all right? Is it my student? What's going on?
Oh no, honey, it's okay. She's in the bathroom with Quentin. We just had a few questions.
Okay. All right. Shoot.
My name's Winton. I'm his twin brother.
Oh.
If you're not familiar with me.
Okay. Yeah.
They're very similar. Very similar.
I see the resemblance.
Yes. So we just had a few questions because the PA came in today and he was talking about dementia.
Sure.
And we just don't quite understand because he wrote a few things up on the board about new meds, and we're just very
Is it curable? Is it does he have it all his life? I'm just worried about who's gonna take care of him, who's gonna drive him everywhere, to his doctor's appointments, to
we noticed some weird things, but we thought he was just getting old. Happens to all of us.
Is there medication to take with this? Is there anything to help him?
Okay, sure. So I see the notes that the PA put on the board. So just to clarify some of those things, dementia is a progressive disease of the brain. So he is going to have more memory loss, and because it's progressive, that means that it is not curable and it cannot be reversed. So if anything, it's just going to continue to get worse in a sense, but it's not going to happen all at once. Like you guys said, that you noticed some things over time, but you didn't really realize that it was dementia, and that's pretty common because there's 7 stages, and so he was most likely in the earlier stages, which patients are still able to drive cars, they manage their own money, and there's just a little bit, like you said, there's just a few things that don't quite click the same. It's just that slow progression. And so a lot of times patients with dementia, they can have it anywhere from 2 to 10 years. So the fact that he's probably had this for a couple of years now already, and it's just slowly starting to progress where you see more of those signs and symptoms more often. So as he progresses through the stages, he is going to need higher level of care. And so as far as does he go home or does he go to assisted living, that's really going to be ultimately up to you guys, what you decide. I know you're going to set up some consultations with some other facility members, and they'll help educate you really on what your options are and sit down with you and really explain everything very well. But yeah, it'll ultimately be up to you guys and what you think, what your wishes are, what his wishes are, and what you think that you can manage as far as time and money. And as for his meds, the PA did start him on Ativan. That's because he's been wandering. And so it's really just for his safety that he needed to be able to calm down and be able to get some good rest. Because when we get good rest, then we stay healthy and we can, in his case, he's not necessarily getting better in the case of the dementia, but in the situation where he's at right now. And the other meds are going to help with his mental cognition to help try and slow that progression so he can be with you guys as long as possible.
That makes sense.
Okay, yeah. I mean, I think it'll be okay if he comes home with me. At least for right now. He's been fine. Except for this. I woke up and he was gone. And the neighbor called.
That's pretty scary.
And it was very scary. But you guys have been great.
Is there a reason, has he frequently got up through the night before? Like, what was it about this night that was different?
You know, I don't really know. I mean, we watched a movie, and it was a war movie, so maybe that triggered. I don't know. I mean, he loves war movies. He was in the war, so I don't know.
Do you have any support outside of? Are you his support system, or is there anyone else in the family?
I mean, there's me and his brother and his wife.
They have 2 kids,
Yeah.
but they live in California, so they can't be around that much.
Okay, so it'll be primarily you guys who are taking
Yes.
care of him. Okay. Yep. So, any more questions at this time?
I don't think so.
I don't
Thank
think
you.
so. I think you answered them all.
Okay,
Thank
good.
you.
Well, one more thing I wanted to tell you guys is that I read the PT report, and they, after assessing him, they think he's doing good. They don't really have any suggestions for him at this time. Maybe, like I said, down the road in one of those later stages, that might be something they need to tackle. But he's still up at lib, totally fine, doesn't need a walker or cane or anything like that. So,
Okay.
that's good news.
Thank you.
I probably should go check on my student.
All right.
See what
thank
she's
you.
up to. But if you need anything else, just hit your call light and I'll be right down.
We will.
Okay,
Thank you.
thank you.
Yep.
Appreciate it.
Okay, so we need to check the assessments. We're gonna get some meds done. Student, come on. All right. So we just had OT and dietitian assessed him, so we need to read the reports, and then we're gonna have to get meds and all this stuff. So you need to stay with me. Okay. So the dietitian said, exercise usually speeds up metabolism. So for example, walking before meals might help with appetite and getting on a regular schedule. They don't have to eat specific foods, but less sugar would probably be good. And then the OT, looks like they said using familiar objects in a familiar environment so they don't get confused during feeding. It's important to make sure the utensils are visible and easy to reach. Adaptive devices can be used, such as a no-spill cup, a Dyson no-spill pad, or a plate with a lid. Sound good?
Yeah.
You with me?
Yeah.
Sure? Okay, well, we're going into the medication room and no food or drinks. Yeah. Okay, so we are going to update his plan of care now. How we're going to do that, we're going to prioritize his care and we're going to base it off of ABCs.
A, B, C. C's is 1, 2, 3.
Focus. And Maslow's. You heard of that?
What's that?
Maslow's? Okay, look it up on your own time. Okay, so his priorities for his plan of care, we're going to focus on his appetite and nutrition as well as his cognitive impairment now that he's a stage 4 or 5 for dementia. So I have here, I think our patient should eat at least 50% of all meals during hospitalization, and that our patient will not wander outside of his individual room during hospitalization. So now that we have these planned, we're going to go and now enter them into the care plan, and we're going to make sure and document whether our goals have been met, if they're ongoing, our rationales for the goals, and how we think our patient will handle this. Are you even paying attention?
I'm a little bored. I thought we could play some cards.
What? How are you even bored? The fact that we're sitting down right now is a freaking miracle.
Okay.
Quentin, what's happening?
Hey.
We're your student.
Student nurse.
Student.
Yeah.
Yeah. I'm your nurse,
Remember.
Mandy.
Hi, Mindy.
Okay, alright. Well, we just wanted to come in and see how lunch went for you. Were you able to get that appetite back, eat most of your food?
Yeah, let me put my cards down. Yeah, I had my protein shake, my Ensure, and then had some mashed potatoes and some fish, like I always do.
Okay,
It was good.
good.
I
That's
finished
awesome.
all of it.
Alright, so it's better for you if you keep eating, at least half of your meal with every meal, so, because you need those nutrients.
I'll keep an eye.
Okay, good job. Awesome. And then how was are you feeling tired or restless? How are you doing in that department?
No, I'm calm right now. I think I'm
Okay.
doing pretty good, pretty well.
That Ativan really helped?
I think so.
Okay.
Yeah, he's been in the room. He's been fine.
Okay.
It's
Awesome.
normal.
Alright, well, before I send you guys on your way, I just want to let you know that you're going to have a couple upcoming appointments. You're going to be meeting with a lot of people in this coming week, and they're going to help you really sit down and talk with you, educate you, and help you be able to make some of those decisions.
Okay.
Um,
It was that about like the VNA, the nurse that'll come check on him.
Yes,
Yeah,
we got
okay.
some home health and
Okay.
then some other appointments signed up with you. And it sounds like you've got your wife and your brother. What was his name again?
Winton.
Yeah, yep. So good support system and to help you through this. Student?
Oh, what's your name?
Quentin.
What's my birthday?
Student.
I'm
Oh.
sorry, what's your birthday?
1946.
Do you know where you're at?
Yeah, I'm in the hospital. St. Ambrose Hospital.
Okay, do you know who the president is?
I think it's Trump. I don't like politics though. I don't get much into it.
Yeah, I know. They play too many cards. But I like cards.
Hi, it was a pleasure taking care of you. Okay, so now that we're done with that, we need to evaluate his care plan, essentially make sure he met all the goals. So do you think he ate 50% of his meals while he was here?
Yeah.
Okay. Did you at any point see him wander outside of his room or in the halls?
No.
Okay, then we would go to our care plan and say that he met those goals.
Yeah.
So I hope you learned a lot of your clinical experience here today.
Yeah. Have fun staying here till 7.
Thanks. Yeah, what are you going to do with the rest of your free time?